Type 1 diabetes occurs when the immune system attacks and kills the beta cells present within pancreas. This attack is by a mistake from immune system. In this situation no, or sometimes very little, insulin is released into the body. As a result, sugar levels builds up in the blood instead of being used as energy. About 10% of people with diabetes have type 1 diabetes. Type 1 diabetes generally develops in childhood or adolescence, but it can also develop in adulthood. This diabetes is always treated with insulin injections. Proper meal planning also helps in keeping blood sugar at the accurate levels. This type of diabetes can also be caused by a genetic predisposition. It could also be the result of faulty beta cells in the pancreas. So, we can now say that type 1 diabetes requires lifelong treatment with insulin injections, and in the majority of cases results from a cell-mediated autoimmune destruction of the beta cells in most individuals. This occurs after a long but variable preclinical period when islet autoantibodies to insulin, glutamine acid decarboxylase and insulinoma, associated antigen 2 and other autoantigens are detected. 1. By age type 1 diabetes may occur at any age, but it is uncommon or rare in the first year of life and it becomes difficult to distinguish from other types of diabetes after about 30 years of individual's age. Nearly all population shows a steady increase in incidence rate with age up to around 10 to 15 years of age. A report from recent data in Finland indicates an incidence in 0 to 4 years of age, and this is nearly as high as that in 10 to 14 years of age. From graph we can see the type 1 diabetes variations in Swedish males. In many populations of the world the rate is lower among people from 15 to 29 years of age, than among 0 to 14 years of age. In some populations there seems to be a second rise in incidence after the age of about 25 to 30 years of age. In the Sweden Overall Prospective Incidence Study of 15 to 34 years of age, 78% of the diagnosed patients were classified as having type 1 diabetes and 15% people having type 2 diabetes at the time of the diagnosis. The follow-up showed that 92% of patients diagnosed before 30 years of age were treated with insulin injections at a later time. These results are consistent with recent incidence data taken from Finland among 15 to 39 years of age. In these studies, the incidence of type 2 diabetes has exceeded that of type 1 diabetes by the age of about 30 years. From comparison, in Turin and Italy, which has a much lower incidence of type 1 diabetes, the incidence of type 2 diabetes is about 3 times higher than that of type 1 diabetes at the age of 30 years. 2. By sex maximum incidence rate of diabetes among children occurs slightly earlier in girls than boys, as we can see in Fig 1.1. In 1970s there was a male excess of type 1 diabetes in children in populations of European regions and a female excess in populations of African and Asian regions, but however, during the start of 1990s, the sex-specific pattern in incidence among children changed towards more modest differences. Total of 112 centers with data taken during 1990 to 1999. Only 6 centers showed a significantly excess of females: Beijing, Hong Kong etc. in China, New South Wales in Australia, Puerto Rico and American ethnic group in the USA, and 6 centers showed a significant male excess: West Bulgaria, Finland, Attica and Greece, Switzerland, Oxford etc., and all differences in data taken from 1990 to 1999 were generally of modest magnitude. Now we can see from the graphs which country has higher percentage of type 1 diabetes, which have lower and intermediate percentages.